Hello everyone, my name is Jenny Rios. This is my patient presentation on week 2 of this course 785. So the patient is a male, 67 years old. His diagnosis is acute hypoxia. Patient called 911 and mentioned he was feeling bad from the nursing home. Up to his arrival, the patient was disoriented and unable to communicate. So right now the patient is under nasal cannula, and the past medical history about this patient is that he has diabetes, hypertension, CVA with chronic bedridden status, left upper extremity amputation, dysphagia, and also he's a PEG dependent. The medicines right now, he's taking heparin sodium, which is an anticoagulant, Protonix, which reduces the production of the acid in the stomach. Colace is a stool softener, and Liorisal, I'm sorry, muscle stiffness and span. He also is receiving antibiotics, and also they are giving two medications to treat the chronic obstructive pulmonary disease and and prevent the bronchos, the bronchospasms, which are the last two. So I received this assessment of this patient because um, they said the patient already lost more than the 15% of his weight in the past 7 months. The admission since was in December 2024. However, in the nursing home, they didn't put his usual body weight, and we don't have any record. His height is 66 inches. He weighs 90.4 kilograms. His BMI is in the obese range. His ideal body weight is 61.2 kilograms. So when I visit the patient, his physical appearance is well nourished. He doesn't have any GI symptoms. The abdomen looks soft, not tender, and we don't have any last bowel movement recorded. So checking his labs and comparing since my assessment, the labs looks much better since admission. When I start seeing his labs, all the electrolytes were high and the bone also was high. Now only the AST is high and the albumin, which we know that EST is like an enzyme of the liver. Something is wrong with his liver. But right now, it's getting better. I can see like a lot of process on his labs. Identifying the nutrition problems that the dietitian is responsible for treating. The first thing is do a tube feeding calculation and recommendation because this patient is PEG dependent. He also has malnutrition, and we have to monitor also the glucose because the glucose used to be high, but right now are in the normal level. The follow-up that I did with this patient because I have luck to follow him. So the patient started tube feeding and he had a good tolerance. And we are monitoring any malnutrition and tracking his labs. But this patient, the weight is stable. Right now, the nutrition assessment and the estimate needs, I calculated uh, calorie needs around 1356 to 1808 kilocalories per day, and the fluids 2055 milliliters, and the protein I recommend 82 to 103 grams. So as I mentioned before, this patient is malnourished because in his history they say they lost more than 15 kilograms in the past 7 months. And when I visit the patient, he was not responding, but I note loss of muscle mass in his legs, fat loss in the orbital region, and muscle loss in the temple region moderate. Um, and also, I noticed that he had protuberant belly noted. So my PIS statement for the patient is inadequate oral intake related to CVA and dysphagia as evidenced by two feeding dependent. The formula that I recommend was Glucerna, and the rate is going to be 60 milliliters every 24 hours. So right now I did a follow-up of this patient and he had a really good tolerance of the tube feeding. I start his rate at 20 milliliters, um, and I'm increasing the rate every 12 hours, 10 milliliters. And the patient is right now in the current goal rate, which, as I mentioned, he had a really good tolerance. The labs improved. We don't have any weight change. I think it's too early to know about his weight, but the patient is meeting his nutritional needs and we will see what happened to him. So that's it for this patient. Thank you so much and I will see you next week.